Have we found a cure for pancreatic cancer? And what does this mean for a total cure for cancer itself? Or is this just more clickbait? Hey, I'm Dr. Sharky. 20 years saving lives. Let's talk health. The cure for cancer has been the holy grail of medicine for as long as I could remember. Now, a research team from Spain has claimed to have completely wiped out pancreatic tumors with no relapse seen following the treatment. There's only one catch. The study was done on mice, so the trial is still in what we call the preclinical phase, that is before we test it on humans. Now, they've tested a combination of 3 different drugs on these mice. These are exciting newer chemotherapy drugs, including what we call immunomodulators, and I've seen them in action. To be honest, I'm thinking that this may be a watershed moment in the treatment of many cancers, sort of like Neil Armstrong stepping on the moon. Maybe one day cancer will be relegated to the status of what HIV/AIDS is now. Now, this new treatment targets what is called the KRAS gene, shortened from Kirsten rat sarcoma viral oncogene homolog, which I admit is a mouthful. The KRAS gene is like a switch, and it regulates a few very important things in the body, including cell proliferation, that is, cell growth, cell division and differentiation, and also cell death, a process we call apoptosis or programmed cell death, which is absolutely essential to eliminate damaged or aged cells from the body. When there's a mutation in this KRAS gene, just like a light switch, it can be left in the on position and send signals to cells to just go on dividing like there's no tomorrow. And these cells are usually poorly differentiated, meaning they're all abnormal cells which go on to become a cancer. Cancer researchers have tried to target the KRAS gene pathway before with drugs, but mostly with just single drugs, which proved to have little effect due to a phenomenon called tumor resistance. But by using 3 agents to target different aspects of the KRAS pathway, this tumor resistance does not take place. A team led by Mariano Barbacid, head of the Experimental Oncology Group at the National Cancer Research Center, CNIO, of Spain, tested 3 drugs that not only proved to reduce the size of the tumor, but also entirely stopped tumor growth with no evidence of tumor resistance for more than 200 days. And there was minimal adverse effects on the test subjects. But I think the most promising things with the KRAS gene is that it is implicated in not just pancreatic cancer, but also lung cancer and colon cancer as well. Cancer is terrible beyond words. Anybody who's gone through it or has family who's had cancer will know what I'm talking about. In my specialty of intensive care medicine, I'm not called in to treat cancer patients very often unless they come to us following an operation to remove a cancer. The reason being, when a cancer patient has deteriorated to a point where their organs are failing, then there's very little chance that going on life support can save them, even if they were fit and well before. Of course, this is not always the case, and it can be a very complex subject to navigate. Now, we do try our best if the cancer is responding to treatment and not terminal, and the patient was healthy prior to being ill. But it is especially tragic when you see young patients who've had a full life before this, and then a cancer will literally destroy you bit by bit until you are unrecognizable. Because even the treatment can possibly kill you or cause permanent physical damage. It can be very depressing to watch all this unfold, and it just reminds me how fragile the human body really is. Now, the thing with pancreatic cancer, which is now the target of this new treatment, is that it can be a very aggressive and insidious type of cancer, and sometimes patients don't even know that they have it until it's too late. Pancreatic ductal adenocarcinoma has a very poor survival rate. In my experience, anything to do with the pancreas is really tricky. Even surgeons are reluctant to touch it in most cases. Now, what does all this really mean right now? In reality, a cure for pancreatic cancer is still not here yet, and we'll have to wait for human trials of these medications to find out if it really works on us. These new immunomodulator drugs are really giving us hope like never before, and I believe the next steps would be gene therapies. I've talked to some molecular geneticists, and they've told me some of the most exciting new mRNA-based therapies are going to be game changers. Most of this research was related to their experience in designing the mRNA vaccines for COVID. So I guess some good came of the pandemic. Well, that's all for now. Please leave a like, subscribe, and I will catch you in the next one. Stay healthy, stay safe.